We are good to go.
Yeah. Uh, Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Foundation quiz for North Zone postgraduates in medicine. I'm welcoming you all on behalf of Fever Foundation. I would like to say a little bit about Fever Foundation before we actually start the quiz. Fever Foundation is an independent, non commercial foundation supporting the educational and academic activity to address the unmet need in the fever management. The foundation is committed to conceive, build, and sustain program and to make scientific initiative which are aimed at providing evidence-based updates to healthcare professionals. If you look at the vision of Fever Foundation, it's to strive towards imparting knowledge on unmet needs and provide information on research, education, and therapy updates on fever management. The activities of Fever Foundation includes conducting annual fever conferences. We have already conducted 6 of them, and this year it's going to be seventh national conference. And throughout the year, we conduct fever CMEs. We bring about book on fever management. Already, we have brought on 13 books. After every conference, we bring about 2 books, one for physician, one for pediatricians. Then the clinical epidemiological research is being done. The first original research activity has begun. Then we also have challenging case presentation competition, young scholar awards, patient education, paramedical education, and public awareness and parent awareness activity. This year we had some special activity in the month of May from 24th to 30th May. Fever Week was conducted. It's the first time in India, in fact, first time in the world, such a activity was conducted. This was commemorate the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and Fahrenheit scale. And through this, we had a lot of scientific events, a national panel discussion. It was a mega seminar which was conducted on 24th May for pediatricians and 25th May for physician on the errors in the fever management. Then we had CME across India. Uh, More than 1,000 programs were planned across India on continued medical education and various aspects of fever and its management. Then we also had patient and public education activity. And I must thank our advisory board members who actually did this activity, did a lot of educational programs during this period, and all in the regional languages as well and through FM radio. Thank you very much for all our advisory board members to helping us do this scientific activity. And we also have a fever research activity that has been initiated. The first original research activity has been initiated at Ellen Medical College, Bhopal. And every year we do PG quiz. Here we have 4 zone quiz: 23rd, 24th, 25th, 26th. Today is the last day for the North Zone. The pediatricians quiz happens at 4 o'clock and internal medicine quiz happens at 7 p.m. So for also, I would like you to note that poster presentation competition we will do in lieu in to the FEFCON. For both for pediatrics and the internal medicine. Last day for poster presentation is 10 September, and the competition, actual competition happens on 17th to 18th of October. So only thing is that you have to be postgraduate to submit your poster, and secondly, the poster has to be related to fever. It can be case presentation or it can be original research. And we have developed training manual on fever. Certificate courses are being rolled out for general practitioner and family physicians also. I take this opportunity to welcome you all to FEFCON 2024, which will be the 7th National Conference of Fever Foundation of India, which will happen on 23 and 24th of November 2024. And before I start, I would like to introduce our panelists and the faculty for the quiz. The quiz master is Dr. Anupam Prakash. Sir is the director and professor and head of the department of accident emergency at Lady Hardington Medical College Hospital, New Delhi.
I'll be just joining in a minute, ma'am.
Yeah, let him join, sir. We can mute, I think, something. Yeah,
Yes, ma'am.
he's editor in chief and associate professor at API Textbook of Medicine. And I think somebody has to mute. I think that sound is very. Yes, sir. Then the quiz master today, we have Professor Dr. Gansham Pangte, sir, Professor of Medicine at Lady Harding Medical College, Delhi, and also he heads rheumatology and medical ICU in charge at LHMC. Joint Secretary to Indian College of Physicians and API Delhi Chapter, Executive Member of Delhi Rheumatology Association, and Associate Director for API Textbook of Medicine 9th, 10th, and 11th edition. He has more than 100 publications to his credit in reputed peer-reviewed journals, co-edited books such as Pearls for Scientific Paper Writing and Research Methodology and Ethics in Clinical Research under PRF. And he is Medicine MD and NB postgraduate teacher and examiner for Delhi AIMS and Delhi. And sir has been helping us in all the scientific activities of Fever Foundation. Dr. Ganjam sir, welcome to the program.
Thank you,
Thanks
ma'am.
very much for helping us. We have two subject expert, Professor Dr. Ramesh Agarwal sir. He's Professor of Medicine at Lady Hardinge Medical College and Associated Hospital. Sir, welcome, sir. You've been
Madam,
very
picture is
helpful.
wrong, image is wrong.
Oh, you're sorry.
No way. I am live here, sir. No issues.
No, but I have to
Yeah.
point.
Yes,
Yes,
sir.
sir. Yes, sir. You are jury, sir. That's quite right, sir.
And Dr. Subha Lakshmi Magreka, madam, she's also professor of medicine. Both Dr. I'm sorry about that, sir. Dr. Ramesh Agarwal, sir, and I'll just correct it, sir. So I'll put the full slide of Dr. Ramesh Agarwal, sir, since I have done a mistake.
I think that's okay, ma'am. Let us proceed further, ma'am. Please.
Okay, sir.
Yes, ma'am. Please. Thank you.
Sorry about it, sir. So,
That's
sir
okay.
is a professor of medicine at Lady Hardinge Medical College and Associated Hospital, New Delhi. And Dr. Subhalakshmi, madam, she is also professor of Department of Medical Medicine, Lady Hardinge Medical College. Both of them have been very helpful for us, and then all the time they help us in scientific activities, CMEs, quiz programs, etc. So, thank you very much, Dr. Ramesh Agarwal sir and Dr. Subhalakshmi, madam. And we have Professor M.K. Sudarshan sir as our jury for the quiz. He is a founder member of advisory board of Fever Foundation. Sir is ex-director and retired dean, principal professor and HOD of community medicine, Kempegowda Institute of Medical Sciences, Bangalore. He is a chairman, state COVID-19 technical advisory board, Government of India from March 2020 to September 2023. He's a chairman of World Health Organization, Southeast Asian region for rabies technical advisory group, Delhi. And he's also a member of National Technical Advisory Group of Rabies, Government of India. NABH Principal Assessor of Ethics Committees and Clinical Trials in New Delhi. And also he is member of various rabies expert and
Madam, cut short,
consultation
cut
of
short,
WHO.
cut
Yes,
short,
sir. And sir has
cut
been,
short,
yes,
cut
sir.
short.
Thank you, sir. He's been helping us in conducting the quiz and any scientific event in a very fair and manner. So he's been there helping us a jury, and he's there for all the 4 days, both the session, afternoon 4 o'clock and evening, sir. Thank you very much for jury for all the 8 sessions. Thank you very much, sir. And before we start, actually, I would like to tell you all about the rules and regulation of our Fever Foundation quiz. The first and foremost is this quiz is for, postgraduates only. The quiz consists of a multiple choice questionnaire, and there will be 15 seconds to answer each question. And the option has to be selected by clicking on the button on the text panel. Please note this, the video display with the option will only be representation purpose only. So you have to click on the text which you see below this video, select the option and submit it. Only then your response will be recorded. Please do not try to click on the video, so the responses, it won't take it, just a representation. And the participants are advised not to leave the platform. Once answer is submitted, it will not be possible to revert. No negative marking. The winner will be the maximum fast right answer. If there is tie, the tiebreaker round will be done to decide the winner. And it is advisable to use laptop or desktop. Should not use mobile phone for getting answers from any colleagues and sitting nearby. Fever Foundation is not responsible for any form of technical errors such as poor net connectivity. The participation in the quiz implies that the participant accept the integrity of these rules. The participants who have given incomplete or inaccurate personal contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and candidature for the prize. First and second winner from each zone will enter national level quiz competition 2024, which is scheduled in 2024 November. So finally, the quiz master and judges' decision will be final. We are all have to abide by this. So with this, I wish you all the best, and I hand it over to our quiz master, a quiz host, to take it forward. Over to you, sir. Gancham, sir, over to you. Sir, you're on mute, sir.
A very good evening and thanks to the FeverCon team and especially Dr. Manjula and the whole micro pharma team for giving us the opportunity to be part of this great postgraduate quiz. And this is almost seventh year in running. Fever FIFCon as well as the quiz is going on. So today we have already completed 3 days of quiz. We have completed East, West as well as South Zone. And now we have reached the last North Zone quiz. And we all also belong to North only. So I hope someone from Delhi wins this quiz or someone nearby, maybe a NCR, UP and Haryana, everyone is North. So best wishes to all of you. And as Dr. Manjula has already told that the quiz will be fastest finger first, and we will be choosing 2 winners in this quiz. And those 2 winners will go to the National FeverCon in November, which will be held in Bangalore. So best wishes to all of you. And we will start with the dummy questions, maybe 3 dummy questions, just to make you hangover of the system, how to choose the answer. There will be 4 options, and there may be some similarity between some option, but you have to choose best option. You just see the best option, and once you have clicked, you cannot change the answer. And the winner of each question will be the fastest finger first and correct answer. The 2 things has to be taken. You should know the correct answer, and your answer should be the fastest to be on the podium for that answer. And maximum number of fastest finger first will be the winner of this North Zone quiz. So I think our jury and anybody else want to add something, sir, Dr. Sudarshan?
No.
Or we should start the quiz?
Yeah, please start with the dummy. Yeah, please.
Okay, we'll start with the dummy quiz. And for this quiz, Computer Ji will be helping us, giving us the question. And some of them may be very difficult, but some of them will be easy. So you have to see how quick you can answer it. So I will request you, Computer Ji, to start the quiz. Okay, so this is the Fever Quiz rules and regulation. I think most of the things has been already told by our quiz team, Dr. Manjula. So first and foremost, you should be a postgraduate. So no senior residents are allowed to participate in this. And second thing is, it is a North Zone quiz. So only people who are postgraduate student in the North should participate. So anybody who wins even the quiz, after this, the team will check that you belong to that place and post-graduation is from that place. Then only you will be awarded the winning check as well as certificate. So I think most of the things that we have already discussed. We can go to the second slide, quiz, Computer Ji.
Demo.
So this will be the dummy question. We'll start with the first dummy question. There will be no marks for it, just to make you hang about the system. So question starts now. You will get just 15 seconds to answer this. Who was the first woman Prime Minister of India? Is it A. Pratibha Patil, B. Indira Gandhi, C. Sonia Gandhi, or D. Mamata Banerjee? Your time starts now.
No,
If
mute,
time is
mute.
over, you will just get 15 seconds to answer it. And I think it's not a difficult question, but you won't be getting a marks. So options are Pratibha Patil, Indira Gandhi, Sonia Gandhi, and Mamata Banerjee. Out of them, Sonia Gandhi has never been placed in a position of even of a chief minister. Mamata Banerjee has only been a chief minister. So option A or B will, one of them will be correct. I'm not sure. Computer Ji will tell us, is it A or B? Okay, so it's Indira Gandhi. I think she's the prime minister, first prime minister, female prime minister. Pratibha Patil, madam, was president of India, first female president. So this was slightly tricky. So this type of tricks may be played by Computer Ji. And after that, Computer G will show us the graph that how many students were correctly able to answer B option, Indira Gandhi G. Computer G, we can show the graph if we are ready with the graph. So it will show you the percentage of people who have correctly answered, and it's 100%.
Great.
So she was from North India and first female, and she was very popular. So it was easy for you to answer. So answer B was correct, Indira Gandhi. So, but no marks for that. We'll go to second question, Computer G.
No, who answered it? Who answered?
Okay, sorry. So
Yeah.
one of the first demo question was Shreyans
No.
Goel, and the person is from Akash Healthcare Super Specialty Hospital, New Delhi. Okay, he's from Akash Healthcare.
I've taken 5 seconds.
I hope it's a
5 seconds.
medical college and he's a postgraduate student. And I think even DNB student we are taking, ma'am.
Yes, sir. DNB we are taking, sir.
There may be DNB candidate because I'm not sure it's a medical college, but there may be a DNB student.
5
Congratulations,
seconds.
Dr.
5
Shreyans.
seconds. 5 seconds. 5 seconds. He has answered in 5
Taking
seconds.
5 seconds. Okay.
Yeah, that
Everyone
also
is taking 5 seconds. They are not. You have to click ABCD.
They're familiarizing with the process.
It will be difficult for you to answer on a mobile phone. If you are on a mobile phone, try to switch over to a laptop or a desktop because you still have time for 2 demo question, maybe 5 minutes more. So everyone try to move on because 5 seconds are too lengthy for answering a Indira Gandhi answer. Computer G, can we go to the second question now? Okay, so this is the question number 2. Which is the national flower of India? Is it hibiscus? Is it B, rose? Is it C, lotus? Or D, jasmine? Your time starts now. Okay, so your time is over and it's 15 seconds over, and I think it is also slightly not very difficult but moderate difficulty question. You should be knowing the national flower at least, but still I will say some people may be confused between B and C. Is it rose or a lotus? Because lotus is symbol of one of our national party also. But jasmine and hibiscus, I'm not very sure even hibiscus how many student will be able to identify which flower is it. So still, Computer G, can we have the correct answer? Is it B or C? Oh, it's a C. So lotus is the national flower of our India, and I'm sure that 100% of the students, or at least 90% of the students may have correctly answered this. And I expect maybe 2 or 3 seconds as the earliest answer. Computer G, can we have the graph? How many correctly answered first? Lotus, and the national party, which is
Flower.
lotus flower is there. So lotus is shining, and you can see here also 80% are correct, but still 20% said hibiscus also. Very surprising. Hibiscus, I think Hindi mein, I think.
No, sir, they're trying whether all options are working.
Okay, yeah, you should that your this computer this keypad is working well, so you should be aware that A option can also be corrected. So hibiscus is Gudhal, I think, in Hindi. And Gaurav Chaudhary correctly answered this question, and he's from Rajasthan, Mahatma Gandhi Medical College and Hospital. I think very near to Jaipur and even Delhi. So congratulations, Dr. Gaurav. It just took 2 seconds to answer this. So your keypad is working good, and you are just ready for the quiz, North Zone quiz. So Computer G, without wasting time, we'll go to the question number 3, demo. Demo question, there's no marks for that. And question number 3 is, where is the Parliament of India located? Is it Mumbai? Is it Chennai? Is it New Delhi? Is it Agra? Your time starts now. Thank you, Computer G. Time is over. Everyone must have clicked it. And this parliament, the Computer G has not mentioned, is it before independence or after independence? Because a lot of places, the capital was there in British times. And there's a new parliament also now. So some people may get confused that new parliament is still in Delhi or it is shifted to New Delhi. So Computer G, I think 100% can still correctly answer because rest of the three options are very unlikely. So Computer G, we can go ahead with the answer. New Delhi, correct? Okay. So it's easy for you. Most of the answers, last three answers, I think majority were in the C section. So C button is working. So Computer G, can we have the graph? How much time they have took? Less than, I think 1 second is the minimum time you can take. So it will be the easiest one. And new parliament is just sideways to the old parliament. If you get time, this recently you should visit this, and it's a beautiful place and beautiful building developed by the new government. It's 100% correct answer. So I think everyone is ready. We can start the quiz, and you know that ABCD how to answer. And Gaurav Chaudhary is again correctly answered, and he just took 1 second. I hope during the theory exam or this medicine quiz also he answers quickly, and we'll wait for you, Gaurav, in the podium. So we are ready for starting this quiz, and answer will be fastest finger first. And you should you cannot change the answer. Once you have answered, that will be logged, or Computer G lock kar denge the answer. So you are fixed with the answer. So just press it accordingly. As soon as the question is read, your time starts there. Okay, we can start with question number 1, Computer G. I think music is not working, Computer G. So typical features of a tropical splenomegaly syndrome are all except increased serum IgM levels. Is it lymphocytic infiltration of the hepatic sinusoids? B is presence of malarial parasite on thick smear examination, or favorable response to prolonged anti-malarial drug therapy. Your time start now. It's accept. Computer G. Okay, so time is over. You must have already clicked either of A, B, C, D. There's no E option. And this question pertains to tropical splenomegaly syndrome, which is also known as a hyperreactive malaria syndrome. So you all know this is related to malaria. And as our country is a tropical country, we should be able to answer this question properly, because this is one of the differential of a massive splenomegaly. So option A was given like a serum test where you have to have antibodies against, most likely this is malaria only. So this is asking these IgM. Others are, one is pathological finding, other was a thick smear examination. So Computer G, first we can have the correct answer, then we can discuss about this hyperreactive splenomegaly due to malaria. So presence of malaria parasite on thick smear is not required to make a diagnosis of tropical splenomegaly syndrome. So this is classically teaching that in this malaria, what is happens that you cannot find the trophozoites or ring form of malaria in your peripheral smear. Instead, there's a hyperreactive antibodies formation against the malarial parasite, and which causes massive splenomegaly because of reticuloendothelial cell hypertrophy. And this causes massive spleen, which can rupture if there's a trauma or any injury is there. Treatment, although is again, it's a chronic therapy with the anti-malarial chloroquine, has to be given for months and normally seen in an endemic region. So here you don't have to, you will not get a card test positive for malaria, or you will not get a PS suggestive of malaria parasite. Just thick smear will be negative in tropical splenomegaly. So this was the accept answer. Computer G, can we have the chart where the percentage can be shown? So 50% of the students pick this answer, which is good. And 50% is rest of them are distributed equally, 15%. So good to know that half of them know that you don't have to get a PS positivity to make a tropical splenomegaly syndrome. But you still have to treat with the anti-malaria. We can have the first winner of our for question number first. And it's a Shreyans Goel from Akash Healthcare Super Specialty. And the person has just taken 3 seconds. Very good. So he started with a demo question, winning the demo question, first demo question, and first quiz question also. Congratulations, Dr. Shreyans. And I will request the Computer G to blow some music also when someone wins the question. Okay, so question number 2. Which of the following statement is correct regarding hydrated cyst? Is it surgical removal of the cyst should not be attempted? You have to say correct. It is caused by a dog tapeworm. It is usually accompanied by a eosinophilia, or it is best diagnosed by microscopy of fluid obtained from ultrasound guided aspiration of the suspected cyst. True statement you have to tell. Your time start now. The true statement out of 4. Okay, so time is over. There's a music bell that it's over for you for answering this question number 2. And this question is related to hydrated cyst, which is another tropical disease most commonly seen in poor socioeconomic strata in a tropical country like India. A lot of persons come with hydrated cysts, a large cystic swelling in the maybe a lung, liver, and you have to treat that. And although there's an anti-hydrated treatment, but still a lot of patient will require a surgery to treat that. So is it surgical removal of the cyst should not be attempted by the first option, which doesn't appear to be correct. Computer Ji, can we have the first correct answer? Okay, it is caused by dog tapeworm. So this was the correct statement here. So you have to be very correct. That question is asking correct answer about that or a true statement. Sometimes it will say all are true except one statement. So that has to be a tricky answering from your side. And dog tapeworm is also called echinococcus. And this is usually a tapeworm which get infected through fecal-oral route only. So there's a large cyst there. So ideally, it should be removed in totality. And other than that, it may present as a eosinophilia because all of the parasites usually cause eosinophilia. And usually for diagnosis, you should not aspirate. You should not put a needle there and keep the needle just for aspiration and diagnosis. Instead, there's a procedure called PAIR, where percutaneous aspiration and instillation of alcohol can be used, where you aspirate everything and then put it alcohol to completely destroy that cavity of a cyst. Otherwise, it's total removal is the treatment of choice of this. Otherwise, albendazole and other therapy can also be given in this patient, but for a small cyst. So we can see the chart, how many students are correctly answered. Dog tapeworm is the correct answer. And 43% of the students are correctly answered, I think, because of the stem and not very common thing in a medical practice, more of a surgical disease is this hydrated cyst. So 43% are still missed it. Yeah.
Sir, I wanted to add one thing,
Yes, yes.
like
Doctor.
that aspiration is not indicated as you told in the fourth option. It is just because rupture or leaking of this can lead to IgE mediated hypersensitivity reaction. That can be fatal also for a patient because it is a hypersensitivity reaction. So for that reason also it is avoided in these patients.
Yeah, correct.
Otherwise, these patients are relatively stable unless this rupture or this puncture happens.
Yeah, so aspiration should be avoided. Otherwise, you can in a radiography or a CT scan only you can diagnose, and a large cyst. So anaphylaxis reaction can occur if you just aspirate and see that what is there. Sometimes it's in the lower lobe. You may say it's a pleural effusion, and you just tap it. Then there may be anaphylaxis reaction. So that should be taken care of. Correctly said, ma'am. Just good to remind the students how to treat a hydrated cyst and what not to do. Not to put needle. Surgeons can put alcohol after aspiration and complete aspiration. Okay, so PAIR procedure can be done. Thank you, ma'am. And let's see who is the winner of question number 2. Computer Ji, can we have the winner for question number 2? Thing. We wanted to hear some firecrackers. And Abhishek Tiwari is from BRD Medical College, Gorakhpur. Okay, Uttar Pradesh, Gorakhpur. Good. It's a famous medical college, Gorakhpur. And good to see the person from Gorakhpur on the podium. So second question. So it's like a Formula 1 race. You will have a lot of podiums, 20 podiums. And winner like a F1 race is number of podium won by the driver. Okay, let's see who is the next winner of our question number 3. Computer Ji, we can go ahead with the third question. Epstein-Barr virus is associated with all except, this is a question with except, hairy cell leukemia, leiomyosarcoma in a young people with AIDS, nasopharyngeal carcinoma, or a oral hairy leukoplakia. Everything is called by EBS except one. Your time start now. Okay, so time is over, 15 seconds. Slightly viral disease, Epstein-Barr virus, and there are 4 statements, and there are 4 diseases. So out of that, one disease is not caused by Epstein-Barr virus. If you have read one of them, because rest of them are easy to pick up, so that may not be caused by Epstein-Barr virus, maybe some other virus. So Computer G, can we have the correct answer first? Your step goes off. So answer was hairy cell leukemia, and this doesn't caused by Epstein-Barr virus. Although nowadays a lot of Epstein-Barr virus infections are being documented and even evaluated. Although it's difficult to test in a routine setting, but they have been found to be having severe leiomyosarcoma or a muscle infection, especially in the patient with the AIDS disease. So okay, so it may cause a leiomyosarcoma in adult AIDS patient. It may cause nasopharyngeal carcinoma. You all know Burkitt lymphoma and all. This is very common with EBV virus infection. And rarely it may cause oral hairy leukoplegia. It's not a cancerous lesion, but precancerous lesion. But the answer was hairy cell leukemia, which is normally present with the pancytopenia, and there's a massive splenomegaly also. And these patients may have some abnormal cells. When you do a peripheral smear, you will see these abnormal hairy protuberance from the cytoplasm. And this disease has been said to be sometime associated with the STLV or human T cell leukemia virus, but few cases only. Otherwise, nowadays it's said to be more often due to a genetic disorder. I think BRAF mutation has been reported, and nowadays a lot of leukemia you do this Sanger technique, or you do a gene sequencing. There you can diagnose. So hairy cell leukemia is not associated with EBV, which was the correct answer. And if our expert want to add anything more than that, because EBV infection is difficult to confirm in a non-tertiary center, we can have graph, Computer G. Okay, so here you can see that first option was only correctly answered by 14%, and the rest of them has some different options. But let's see who's the winner for this question number 3. Hairy cell leukemia. M. Pira Reddy is from Akas Healthcare Super Specialty Hospital. Again, congratulations, Akas Hospital and Dr. Reddy. And she took I'm not sure. Dr. Reddy, I will say, I will not say he or she, I will not be a sexist here. So it will be a Dr. Reddy winning the question number 3. But the person has taken 6 seconds good, because this was a difficult question. And a lot of person or a student must have ticked early and with a wrong answer. That's why they may have missed. Congratulations, Dr. Reddy. It was a difficult question. Maybe the person is more interested in oncology and virology also. So great to know that correctly answered. Computer G, we can go to the question number 4 now. So question number 4, all of the following drugs can be used in the treatment of Legionnaire disease except, there's except option. Rifampicin can be used, gentamicin can be used, or erythromycin can be used, or ciprofloxacin. One of them cannot be used, should not be used. Your time starts now. Thank you, Computer G. So question number 4 was related to Legionnaire disease, and this question is again with a negative stem. So rifampicin can be used. Should gentamicin can be used or not? I'm not sure, because nowadays we are using different aminoglycoside. Maybe amikacin can be used or not can be used. Computer G will tell us. There may be some reason for that, but Legionnaire disease can now. We all know that Legionnaire disease can present as an atypical pneumonia. Previously, we used to differentiate pneumonia as a atypical versus typical pneumonia. We used to think that Legionnaire Mycoplasma, chlamydia, and listeria can cause atypical manifestation as a pneumonia. And while streptococcus and staph aureus causes the typical pneumonia, they are causing typical lobar pneumonia, while they can cause bronchopneumonia. Their symptoms are also slightly on the lower side. They are not very sick looking. But treatment wise, nowadays we differentiate between typical and atypical, not typical and atypical, but we say is a community acquired pneumonia or a hospital acquired pneumonia as a treatment of choice. So computer G will first tell us which antibiotics should not be used. It said gentamicin should not be used. Rifampicin can be used, erythromycin or azithromycin can be used, or a ciprofloxacin can be used. Maybe the reason is given is Legionnaire is usually as a gram-negative organism. It is intracellular in the pathogenesis. So gentamicin cannot cross the membrane and it doesn't act inside the intracellular organism. Therefore, it should be avoided because it won't be effective. And the answer is 57% of the student were, I think correctly, I think B option was correct, if I'm not wrong. So I think B, Legionnaire. And one thing different about Legionnaire disease is this is a pneumonia, but when you detect diagnosis, you may have to do a urine test to find the Legionnaire antigen test. So in urine also you can diagnose a community acquired pneumonia or atypical pneumonia. So very few labs are doing this thing, but most of answered the question. He is from ESI Hospital, PGIMS, New Delhi only. I think last year also Deepu won, I think North Zone. Congratulations, Deepu, for again winning one of the podium. And he has won the question number 4.
Deepu Rajan has been one of the very avid participants in most of our conferences and medicine updates, Dr. Ghanshyam. He was there for last meeting of the API also, before that for the medicine update at Lady Harding also, and for the next meeting also he is in line.
So he must be scared that everyone is noticing that he's reaching podium again and again and everyone is noticing him. Congratulations, Dr. Deepu, for winning the question number 4. But everyone should remember this is for postgraduate quiz only. It's not for senior resident. If he has already passed the exam and become a senior resident, so he should be cautious about answering further questions. So we can go to the question number 5. Computer G. Okay, question number 5 is which of the following are the diagnostic method of dengue? Is it RT-PCR? Is it nucleic acid amplification test? Is it enzyme-linked immunosorbent assay? Or is it all of the above? Your time starts now. Dengue. Your time is over. I hope everyone has answered. And this was related to dengue, which is presently going in an outbreak form, even in Delhi, as well as a lot of South Indian states also, Kerala and all. So you all must be doing these tests. But some of tests are not very commonly used. Some are only for research purpose, like RT-PCR. But first, computer will tell us that can we use all 3 or we can use one of them only? Because one of the options should be correct, not all of the not A, B, C, D, any other than that. So best answer will be computer G will tell. So all of the above. So you can see here, A, RT-PCR is also correct answer. Nucleic acid amplification test is also a correct answer. And enzyme-linked immunoassay is also correct answer because all of them can be used. Although RT-PCR is only used as a research purpose when you have to confirm a patient of dengue, like someone who dies of a dengue, CNS dengue or a dengue meningitis. There you may have to do a RT-PCR, and especially it's positive in initial 5 to 7 days only. So there you may require a RT-PCR to document it is dengue infection leading to a atypical death. Other than that, we all are using enzyme-linked immunoassay, especially ELISA. And ELISA, NS1 ELISA, we are using for initial 5 days, and after 5 days, we are doing IgM ELISA. And the national body, like our Ministry of Health, only register a case of dengue when it is ELISA positive. That has to be taken care of. While the rapid CAR tests, which are used randomly from the marketplace, which is not authorized. So non-ELISA are not considered to be a confirmed dengue. They are called probable dengue. But all of them can be used. The answer is correct is D option. I will request any of the our expert want to add some points if they need be common disease.
Sir,
So
very rightly said, as because we need to know when we have to test which test is to be done when. Because if time selection is not correct, and if initial days if patient has come with a short history and we have gone for ELISA, then it might come negative and the misdiagnosis can be there. So that is very important, sir.
yeah, correctly said. But just like we said, the 5 days, initial 5 days, you have to do NS1 and followed by IgM ELISA. But on 5th day, you have a query. So you should do both of them if you want to diagnose. Although if you see treatment part, treatment is fluid only. There's no antiviral treatment. So treatment remains same. So some of the senior physician and dengue expert will say you don't need to do test, because if someone is in a shock, you have to give IV fluids. If not in shock, orally accepting, you will have to give oral fluids. So no required for test and save money in testing. So only for documenting purpose and public health, it is required to know how many dengue is occurring. So we can go to the second question, next question. Sorry, we have to see the graph who all have correctly answered. D option is the correct answer. And it's 86%. Very good answering. And a lot of people have also correct answered ELISA only 14%. So this was a slightly tricky question. All of the above was easy to answer. If they know 2 options are correct, you can easily click the all of the above option. So Computer G has played a trick with some students, and Shreyans Goel was not tricked. And 2 seconds, and the person is again from Akash Healthcare Super Specialty Hospital. So Akash Healthcare is doing very good, and I think one of them may be in podium at least. First or second place can easily be one of the Akash student. We can go ahead with the question number 6, Computer G. In lepromatous leprosy, which of the following statement is true? True statement. Neuropathy occurs before skin lesion. Initial skin lesions are typically anesthetic. Skin lesions are typically symmetrical, or the lepromin test is positive. Only your time starts now. One of the answer is correct. Thank you, Computer G. So 15 seconds are over. This is question regarding leprosy. And you all know leprosy can present as a neuropathy, peripheral neuropathy, mononeuropathy, or a mononeurosis multiplex also, or skin lesions. And that may be anesthetic also. So Computer G has slightly played trick that which one of the correct answer. And is it symmetrical, asymmetrical? There's an early anesthetic involvement. So Computer G has correctly answered. Skin lesions are typically symmetrical. So lepromatous leprosy is a multibacterial leprosy, severe form of leprosy in which skin lesions are usually diffuse, whereas there are significant number of lesions when the disease starts, and it's usually symmetrical compared to a tuberculoid leprosy where lesions are less in number and they are more less in number, and they are asymmetrical to start with. And this is also correct, not a correct statement that initial skin lesions are typically anesthetic. Later on, they become anesthetic, and there will be severe neuropathy in the later stage. But initial stage, there may not be any anesthesia, and nerve conduction velocities are also normal in initial stage of lepromatous leprosy. And neuropathy occurs before skin lesion, which is not true. Early disease, there is no neuropathy, and later on, they develop neuropathy compared to a skin lesions. And yesterday also, Dr. Ramesh has told clear-cut that lepromin test should not be used as a diagnostic purpose, but it's more of a rarely used. And this suggests that lepromin test can be used as a your cell-mediated immunity thing can be diagnosed with this, and which suggests that it is usually negative in a lepromatous leprosy. Lepromin test is negative in this, and to just confuse you, they have given the lepromin test is positive. So it is usually negative in severe leprosy or a multibacterial leprosy. So answers.
So, Dr. Ghanshyam, it's important for the postgraduates to know how to palpate the nerves. They miss the palpation of the ulnar nerves when they are doing a clinical examination, and it may be the manifestation of leprosy with some hypopigmented patches which are present on the back, and uh, it is generally forgotten in a neurological case.
Yeah, so you should remember that ulnar nerve should be palpated, which may be thickened, and they may not be symptomatic in early stages, as it is written also. Initial stage, there may not be neuropathy, but ulnar nerve thickening may be there, which is peripheral, more exposed area, and it's good to palpate ulnar nerve in these patients, especially of a peripheral neuropathy or a mononeuropathy. Thank you, Dr. Ramesh, for adding important points, especially one of the differential for a thickened nerve, especially in a tropical country like India. And we can have the graph, how many percent have correctly answered option C. Okay, so 66%, 2/3 of the students were correctly able to identify that this is lepromatous leprosy, correct answer. And nobody has much given option D as any option, because lepromine test was recently discussed also. So we can have the winner of question number 6. Rajan has come back again. He has just took 4 seconds to answer this. He is from ESI Hospital, Basai Darapur, New Delhi. Congratulations, Dr. Deepu. And we can go ahead with the question number 7 now. The question number 7, the following are recognized feature of onchocerciasis, except it's a keratitis, hanging groin, Calabar swelling, or a eosinophilia. Your time starts now. Thank you, Computer Ji. So time is over. This is slightly, it's a filarial disease, onchocerciasis, and most of these features are there. And one of them is not a feature of this that we have to tell us. So this is a filarial worm which is caused by onchocerciasis volvulus, and this is also known as river blindness, which usually occurs in sub-Saharan region or African region. So Computer Ji will tell us that nowadays a lot of travel is going on, so you may see a lot of patients from Africa, Middle East coming to India for treatment. So if you are able to see these tropical disease, which is not common in India, in Indian form we have elephantiasis or filariasis, which is caused of Wucheria, which is same group of parasites, but they have a different parasites, and this can cause blindness. So keratitis is common disease in that. And which one is not, we will ask the Computer Ji to tell us and help us. Computer Ji, we can have the correct answer. Calabar swelling is slightly different compared to this river blindness caused by onchocerciasis. Calabar stands for a place which is in Nigeria, I think, in Africa. And this is also caused by a Loa filaria. It's again a filarial infection. But they have a swelling, subcutaneous swelling where that worm resides. So slightly different etiology, but it's again a filaria. And eosinophilia is commonly seen in both of them. And any parasites like filaria and all, you do find eosinophilia. And sometimes we do test for eosinophilia, especially night time we do microfilaria test previously. So Calabar swelling, slightly difficult for Indian person because slightly less, but we should know a lot of travelers are coming to multinational hospitals.
Yes, and the treatment is ivermectin, Dr. Ghanshyam.
Okay,
Ivermectin.
for onchocerciasis. Okay, so ivermectin will be the drug of choice, and we are using ivermectin even for our filariasis also. In
Yes.
other than DEC, ivermectin is 12 milligram is also used. So
was this drug also used in COVID?
Yeah, ivermectin, I think, was used in COVID in good number, and still it's controversial, is effective or not. A lot of
Yes.
controversy theory are still going on that someone, because it was very cheap. So it
Yes.
was used, and still we can still do another trial because COVID is again coming. So we
Yeah.
never know. It can be reused again. So Computer Ji, can we have the answer? I feel option C will be slightly not 100%, but 43%. So it was a question, not disease, not pertaining to India, but more from Middle East and Africa. So still 43% student picked the answer, which is good. And we can have the winner, Computer Ji, who were able to know Calabar place and Calabar swelling, which is due to some other. Dr. Sarthak Shah from Rajasthan MGM College, good. So all states have already participated in podium. Rajasthan is there, Delhi is there. We have Uttar Pradesh is there. Still Punjab, Haryana, we are waiting for their participation. And it just took 1 second. Great. It's 1 second is too good for this question. So, Computer Ji, we can go ahead with the question number 8. Which day was declared as World Tuberculosis Day by the World Health Organization? Slightly difficult question for remembering. Is it 24th March, 24th April, 7th April, or 14th November? Your time starts now. World TB Day. Okay, so Computer Ji is over. I think this is like yesterday only we discussed with Dr. Sudarshan and our micro team. We should have some question about public health also. So that's why Computer Ji has brought this question that we celebrate so many days. Every day is should be celebrated. And 1 or 2 name is already given. We all know 14th of February, we all very well know. So we should also note that we should celebrate World Tuberculosis Day also, because millions of people are suffering for tuberculosis, and even our Prime Minister is very eager to eliminate tuberculosis, and now RNTCP has been renamed tuberculosis elimination program has been launched by our government. And first we'll see the exact date so that student stress is over. Then we will request Dr. Sudarshan to add something about tuberculosis day celebration. It's 24th March. A option is correct. Sir, will you like to add something about these days?
No. I will not, because it is getting late. I think we'll go ahead. Yeah, please.
So
please.
24th
Thank you.
March is celebrated as a World Organization, World Tuberculosis Day. 14th November, you all know it's a Children's Day. While 7th April, 24th April, I think 24th April is a
WHO Day. WHO Day. World Health Day.
2 days, 24th is important. And you should remember 2 14s are important, like 14 February and 14 November are important for everyone to remember. So Computer Ji, we can go ahead with the graph. Good to know 71% of the tuberculosis day, they are easily, they are able to make it out. So good to know that tuberculosis elimination government is planned for 2025, but it is going to be some few more years to eliminate this difficult to treat disease. And let's see who is the fastest to know that World Tuberculosis Day is on 24th of March. Healthcare, good. See, the person has just taken 2 seconds to know that it's World Tuberculosis Day. Maybe this time they have their hospital has participated in World Tuberculosis Day, or recently they have a TB seminar where the Dr. Goel has got a this topic of review, tuberculosis elimination in India. So let's go to question number 9, Computer Ji. Question number 9 is, all of the following statements are true about giardiasis, except can be diagnosed by a duodenal biopsy, leave the small bowel morphologically normal, causes abdominal distension, usually respond to treatment with metronidazole. Your time start now. It's a negative question. Thank you, Computer Ji. So this question was slightly, stem was negative. All the following statements are true. So all 3 are true except for one, which suggests that giardiasis is not involved in that. So giardiasis is one of the tropical disease. Pico-Road contamination causes this thing, and normally present with a chronic diarrhea and malabsorption also. So it's very difficult to diagnose and treat also. And but suspicion should be there before treating this disease. First, we will like computer to just highlight the correct answer. Okay, so it's a leave the small bowel morphological normal, which is a not correct statement. Correct statement is it involves the small bowel disease, especially like duodenal biopsy can diagnose giardiasis. So small bowel diarrhea is a predominant presentation, and this will present also as a malabsorption because small bowel are involved, and this will be a large bowel diarrhea also. And they may present as a IBS symptom like irritable bowel syndrome with abdominal distension, incomplete evacuation. And treatment is easy. Metronidazole or a tinidazole can be used. Other than amoebiasis treatment, the treatment is slightly prolonged for giardiasis. It's not just 3 or 5 days treatment will eliminate giardiasis. For giardiasis, you have to give at least 7 days of metronidazole or a tinidazole to completely remove this giardiasis. So treatment duration slightly prolonged compared to a anti-amoebic treatment.
Yes, and sometimes children can have chronic giardiasis, Dr. Ghanshyam, and in those patients, the treatment pediatricians sometimes recommend to over about 2 to 3 weeks for treating chronic giardiasis. And generally, what you said that metronidazole is the treatment of choice for this condition.
Okay, so sometime up to 2 weeks you have to give it, and maybe in a immunocompromised status, those chronicity or patient, young pediatric patient, maybe a longer term should be taken care of. And but stool examination and all can also diagnose giardiasis. So, Computer Ji, can we have the results? How many students have correctly answered B? And 83%, very good number of students have correctly picked the answer. Giardiasis usually involve the small bowel. And can we have the winner for this question number 9, Computer Ji? Question number 9, giardiasis, and one of the leading in the podium list is Shreyans Goel only. So again, Akas Healthcare Super Specialty Hospital and New Delhi, from New Delhi. Congratulations, Dr. Shreyans. We will go ahead with the 10th question, which will be the halfway through the quiz. Then we can see how many students have correctly answered. All of the following, which one of the following drugs can be used orally for the treatment of visceral leishmaniasis? Is it amphotericin B liposomal? Is it amphotericin B deoxycholate? Is it multifocin or is it paramomycin? Your time start now. Thank you, Computer Ji. So 15 seconds are over. I hope most of them have correctly answered. This was an easy question for especially postgraduate student. Maybe undergraduate, it would have been difficult. So we all know visceral leishmaniasis, I mean to say Kala-Azar, which is another DD for massive splenomegaly, which is very common in our North Indian population. So this quiz is for North India. So maybe someone from Gorakhpur may have already answered it. Although a lot of research has been done from Banaras Hindu University, Varanasi. And Computer Ji, can we have the option C correctly answered? Okay, so I have already told Computer Ji that multifocin will be the correct answer because this is the only drug which is orally given in these patients. Other than that, amphotericin B liposomal is an injectable drug. Amphotericin B deoxycholate is also injectable drug, and paramomycin is another injectable drug. So in Indian setting, we are not very commonly using multifocin, but there has been significant number of trials, especially from BHU Varanasi, where they have shown that it is also equally effective, can be used. Although drug of choice remain the amphotericin B, and liposomal drug is slightly costly, but it is less side effects, especially nephrotoxicity is less, and you can give a up to 5 milligram per kg of dose in a single setting without having much of side effect compared to amphotericin B deoxycholate, which can be only given up to 1 milligram per kg per day. So multifocin, which comes in a 100 milligram tablet, can be given BD dosing for a month or according to response. So this was the only oral drug, and I feel most of the medicine student must be knowing, whoever has seen this as any literature review. So any of our expert want to add any points, or we can go for a graph? Okay, so Computer G says 60% of the student has correctly answered the multifocin, which is the correct answer, while 40% still were not very sure it is paramomycin or not, which is another injectable drug. So 60% correctly answered, good to know. Although we are not using practically even in Delhi, in North India, it is on literature, but they have shown that it is also effective for effective treatment for leishmaniasis. Some patient may not tolerate amphotericin B because it's very injection is costly, as well as in some patient there may be nephrotoxicity. So there multifocin can be a good drug, and especially in rural and a peripheral setting, this drug can be.
Yeah, so the students, they know Dr. Ghanshyam that I think they are using amphotericin. That's why they are sure that it is not an orally available drug.
Yes,
So,
A and B option was totally
yeah.
out.
Yes.
Good, great. So MCQ answering is one of the trick you all know, because you have all cleared the postgraduate, undergraduate examination. So they know that A and B is not there. So they have taken chances with C and D. And C was the correct answer. Good. So Deepu Rajan again won this halfway stage. I will request our team, especially from micro team Fever Foundation, to let us know what is the result till 10 question. Dr. Manjula ma'am can help us.
Yes, sir. Well, they are going to now show the result scorecard as of now. How the people are faring. Yeah, they're ready. They may require about half a minute.
A lot of infective disease was covered, and I think more about tropical disease. So Computer G has taken care of preventive medicine and tropical medicine. Okay. Ma'am, if you can just let us know the results.
Sir, it's been on display, sir. Can you see?
Yeah, it's a Shreyans Goyal is coming for at present first. 4 correct answers. Second is Deepu Rajan, Abhishek Tiwari, Sarthak Shah, and Dr. Pira Reddy has already reached one podium. So chances are very good for above 2, but still 10 questions are there. Anytime this can be changed, and the race can be won by anyone, a new participant also. So still anybody who can join, who has already registered, can join. We can go ahead with the
Dr. Sudarshan sir.
Yeah,
Dr.
Yeah, Dr.
I
Sudarshan
recommend
sir.
Dr. Professor Ghanshyam Pangte to take some rest. He has been continuously
No, sir,
speaking.
we'll complete it. No,
And
we have
somebody
taken rest. No, we have taken rest, sir. 10 questions we have already done.
Okay. Okay.
You can go ahead.
As you please. Yeah, over.
So we can go ahead with the question number 11. So Bacillus calmette-guerin BCG contains the avirulent strain of which of the bacilli? Is it human tubercle bacilli A? B option is avian tubercle bacilli B. C is bovine tubercle bacilli C, or a D, atypical mycobacterium. Your time starts now. Thank you, Computer Ji. So the question was regarding BCG vaccine, and here are the 4 options given, all of the bacilli which are related to mycobacterium only. So if someone has read that which tubercle bacilli is given in BCG vaccine, they can easily answer it. But we have a lot of uses for BCG vaccine. We can discuss later on how and where we can use BCG, and what is the importance of BCG vaccination. We are still doing BCG vaccination in India, but not in USA. So why we are not doing, what is the evidence, we can discuss first. Let's reduce the stress of students. Computer Ji, first let us know, is it A, B, C, D, or C only? Okay, so it's a bovine tubercle bacilli. This bacilli is used for making BCG, and it's a avirulent form, so it cannot cause disease. They are made avirulent by killing these bacilli. And BCG has been used in some condition, like it is used for bladder cancer also, where BCG, I think drip is used for by urologists mainly in early bladder cancer. Other than, there has been data which suggests that giving BCG vaccine can prevent tuberculosis up to 70%, but range is very, very wide. It's 0 to 70%. So some data suggests that it has no benefit BCG when you give at birth and around the birth, while some data suggests it causes improvement in your immunity, cell-mediated immunity, up to 70%. So Indian government also believe that it is giving benefit to our public. So everyone gets BCG vaccine on birth until unless patient is immunocompromised. There only you don't give BCG vaccine. Any of our expert want to add, or we can go ahead with the results with the Computer G?
We can go ahead, sir.
Okay, we can go ahead. Computer G, show us the results. Okay, so 66% has correctly answered. BCG vaccine is by bovine strain of this thing. So it's just memory. You can easily pick it up that somewhere I have read in some second year, third year that BCG is made by during a I think PSN class, they must have read this
Correct,
thing.
correct,
And sir, yes.
correct.
Dr. Sudarshan must have taught thousands of
Yeah, right.
BCG is made this way and this
Yeah.
is. So, Computer Ji, let's see who has remembered his undergraduate class of BCG. Maharaji College, Rajasthan. He just took 1 second, very quick to answer. And like Dr. Ramesh also told that bovine tubercle bacilli has been also used in COVID immunity improvement. There has been trial from PGI Chandigarh and some more centers, and they found some good immunity with the BCG. Bovine tubercle bacilli. But I don't think it was commercially used. This bovine bacilli, avirulent form. We can go ahead with the question number 12, Computer Ji. Question number 12. Which of the following most accurately describe hypothermia compared with fever? Is it hypothalamic temperature setting is increased in fever, whereas it remains unchanged in hypothermia? In hypothermia, the skin is usually cool to touch, whereas in febrile illness, the skin tends to be warm. Pyrogenic molecule contributes to both hypothermia and fever, while response to antipyretics such as acetaminophen and aspirin is seen in both. Your time starts now. Okay, so Computer Ji, time is over, and this question is regarding hypothermia, which is recent heat stroke. A lot of death has occurred in our country. Good number of people died in North India, maybe in South India also. So there, one of the cause was heat stroke, which is similar to hypothermia only, heat hypothermia. And I hope most of the residents were already updated and revised the hypothermia cause compared to a simple fever. So Computer Ji will let us know that which option was correct, although it's a long options were very long. So it suggests that hypothalamic temperature setting is increased in fever, whereas it remains unchanged in hypothermia. So if this option was very first option, so it could have easily picked up if you have read that heat stroke and hypothermia. The hypothalamic thermostat is not changed there. Okay, so because of external heat, external maybe your clothing and environment, the temperature increases, and that causes hypothermia. And the other than that, like any infection is there, pyrogen is there are a lot of cytokine release, and prostaglandin is activated, PGE2, which goes to the hypothalamus and act on the hypothalamus to increase the thermostat, leading to fever, which is a normal circumstances. In hypothalamic, in hypothermia, this doesn't, these pyrogens and these PGE2 doesn't act on hypothalamic thermostat. So that was the easiest to pick up first sentence. and rest of the options were slightly less likely, like D response. They have written that response to antipyretics such as acetaminophen and aspirin is seen in both. So only in normal fever or a fever with infection that antipyretic will act. In hypothermia, these molecules, acetaminophen, aspirin doesn't work. Similarly, pyrogenic molecule contribute to both hypothermia. No, pyrogenic molecules only contribute to fever with any pyrogens or a infections or inflammation. In hypothermia, the skin is usually cool. No, hypothermia is usually skin is more of a dry and therefore less of a sweating. That leads to more of an increase in temperature. So external cooling will be the treatment of choice in hypothermia or a heat stroke. So Computer G, can we have the options? How many students have correctly answered? 50% of the students have picked hypothermia and thermostat is not changed. And external temperature and skin is more often dry in these patients. And acetaminophen doesn't act in hypothermia. So Computer G, can we have the winner also? 50% of the students out of these 50%. Dr. Gaurav Chaudhary has correctly answered. He is from Mahatma Gandhi Medical College and Hospital, Rajasthan. He just took 2 seconds to answer it. Congratulations, Dr. Gaurav. We'll go ahead with question number 13. It's a 35-year-old woman presented with fever, malaise, and a painful swollen knee. Her synovial fluid analysis showed high white cell count and a positive gram stain for gram-positive cocci. What is the most likely diagnosis? Is it gout? Is it septic arthritis? Is it rheumatoid arthritis? Is it reactive arthritis? Your time starts now. Thank you, Computer G. So 15 seconds are over. The stem of the question suggests that it's a young female, fever, malaise, and a painful swollen knee, which suggests it's a monoarthritis. Only one joint is involved. So if you see it's a large joint, one joint involved, and they have clear-cut said that white WBC count or a white cell count in the synovial fluid is raised, and clearly said there is a gram-positive cocci even in gram stain also. You can see it's a most sadly maybe a Staph aureus infection commonly in joint. So you can easily pick up that it is must be a B option, septic arthritis, which is the most likely, although gout may also present as a monoarthritis sometime. Although gout usually involve first MTP joint or a big toe is the most commonest involvement, up to 80 to 90%. But single joint involvement, large joint involvement with a gram-positive cocci, easy to pick up septic arthritis. Computer G, can we have the answer? Is it B or a A? Okay, it's a B again, septic arthritis. While rheumatoid arthritis is more of a polyarthritis, number of joints are more than 5 joints, and usually small joints of the hands are involved. Similarly, reactive arthritis is also not a monoarthritis usually, and it involves the hand as well as large joints of the limbs can also be involved, but they may have a backache or a spondyloarthritis features also. So this was easy to pick, clear-cut gram-positive cocci. So I think 100% of the student must have correctly answered. This was a clear-cut. And for diagnostic septic arthritis, first is clinical suspicion, and second is you have to aspirate the joint, take a synovial fluid testing, and do the gram staining and maybe a culture. Computer G, can we have the graph to know that who 100% are correct in B option? Okay, that's what I said, 100% are correctly answered. So, but winner will be only एक ही winner होगा इस question का, और वो होगा जिसने सबसे पहले आंसर दिया. Who is the finger? Who is correctly answered? Rajan has taken 2 seconds, 1 second to read the option A, and B. For reading B, he took 2 seconds.
I think Dr. Ghanshyam, Dr. Deepu Rajan will go with you in the flight to Bangalore this time.
I will ask. We can go together. Sure. From Delhi, we'll take him. You will also join us.
Yes, I will also join.
Congratulations, Dr. Deepu, for again winning this question. And still, we have 7 questions left, and they are still not. If you win all 7, you can be a winner of this quiz. Easily winner of this quiz, hands down. So we can go ahead with the question number 14. Recurring chills and fever in malaria are due to, is it destruction of micro and macro gametocytes by the WBC, rupturing of RBC by rapid multiplication and release of hemozoin, or is it toxin released from the trophozoites, or is it sporozoites released from RBC and are rapidly being killed in the spleen? Your time starts now. Thank you, Computer Ji. So time is over. This recurring chills and rigors is the classical presentation of malaria. Although yesterday and day before yesterday also we discussed malaria, where we did discuss that malaria can present even as a diarrhea and very atypical symptoms. But whenever there's a short history of chills and rigors, and you should always remember that malaria can be an option. Other than that, chills and rigors can be due to any abscess or any pus collection in the body, or sometimes like pus collection in the urinary tract may be causing a pyelonephritis, or in a liver abscess, or in a parenchyma in the lung. Those all should be ruled out, but this will be a clear-cut history of any, maybe a visit to an endemic region or a recent surge in mosquito which bites. But question was not that you have to identify malaria, but they have asked a question theoretical that why they have chills and rigors. So Computer Ji will let us know why they have fever, although fever may be tertian or a quartal fever or every 48 hours or a 72 hours. So Computer Ji suggests that it's rupturing of RBC by rapid multiplication and release of hemozoin. So this is the correct answer, B option, which suggests that hemozoin is also a toxic material or a molecule which is released when these RBC get ruptured. So they rupture in a cycle like 24, 48 hours with their replication. Like in a tertian fever, they have every 48 hours there's a multiplication and rupture of seasons. And these
Yeah, and then Dr. Ghanshyam, that still the gold standard for diagnosing malaria, I think, is the peripheral smear. There are many rapid tests which are available which can diagnose malaria. But the fallacy with these tests is that even after the treatment, they remain positive for about four weeks. So if a patient who has already been treated with malaria comes to you and do this rapid test, it will come falsely positive. So for the postgraduates, they must understand the difference between a rapid test and the gold standard test for diagnosing malaria.
Yeah, correctly. Like above also they did gametocytes and all, like these may still present after anti-malaria therapy. So
Yes.
people need to know that gametocytes may be there and the patient may not have fever and other symptoms. So, and rapid CAR test like after treatment also that may be positive. That has to be taken care of. The gold standard remain trophozoites or a ring form you identify on a peripheral smear. But a lot of time we don't have a good lab to detect, and a lot of time we are not able to make thick slides and thin slides that may cause you a. But there is some new technology has come where you can find those ring form or this trophozoite. When you have a blood sample, you take a centrifuge of that sample, and the test I think is called QBC test or a quantitative Buffy code, where you tag that this thing is trophozoite with a fluorescent dye, and after centrifugation you can detect easily those things. But diagnosis is peripheral smear only. You have to detect trophozoites as well as ring forms to diagnose this thing. And rupturing is due to hemozoin, that you have to remember for this MCQ for getting to the podium. Let's see, Computer Ji, how many are able to make that hemozoin causes the fever as well as chills in these patients. 67 have correct, 67% good. Majority, 2/3 of the students were able to pick that rupture of seasons followed by release of hemozoin, which is a toxic material of heme, causes high-grade fever and chills in these patients. And we should be able to have a good lab to detect these trophozoites and ring forms. Computer Ji, can we have the winner for question number 14? good to see Dr. Vidita is there from Mahatma Gandhi College, Rajasthan. And she just took 1 second. So she knew about hemojoins and she immediately pressed the answer. Congratulations, Dr. Vidita. Best wishes to be on the podium for next. We still have 6 questions to go ahead. Computer Ji, we'll go ahead with the question number 15. Okay. Which of the below statement is true about chicken pox? Is a chicken pox has an incubation period of 3 to 5 days. Rash is preceded by a Koplik spot in the mouth. Should be treated with topical acyclovir. May follow from close contact with a case of shingles. All are true. One is true. Sorry. Your time starts now. One of the statements is true. Your time starts now. So, chicken pox, I think this is a common viral infection in childhood, and this may present as a reactivation of varicella in the form of herpes zoster reactivation later on when patient immunity reduces, like in elderly person or maybe any immunocompromised status. So that may present as a herpes zoster or a zoster or shingles also called. So D option was may follow from the close contact with the case of shingles. Okay. So Computer Ji, can we have the correct answer? Okay, so this was the correct answer. May follow from the close contact of the case of shingles. So shingles is also known as a herpes zoster, which is usually caused by the reactivation of the chicken pox, which may have had an infection during a childhood. Good thing is during childhood, this chicken pox is a milder form. They present as different crops of small vesicular lesions. They start from the abdomen and trunk, then they centripetally follow the other external part. And treatment is can be given early stages, initial 3 to 5 days of rash. You can still give acyclovir, but that is oral acyclovir. Here it is given a topical one, which is doesn't have a much effect. Koplik spot, I think this is more commonly a small yellow spots in the mouth, more commonly seen in, I think, measles. So this was just given to confuse you about the chicken pox. And incubation period is slightly more, I think 2 weeks or 2+ weeks, Dr. Ramesh. I think
Yeah, around 10 to 12 days. Yeah, generally more than that.
this was also not
And
a statement.
yeah, and in the adults also, this chicken pox can happen either as a primary or when the immunity goes weak, as we see in cases of immunocompromised states, like someone suffering from multiple myelomas or on chronic steroid therapy. So they may also acquire it from coming in close contact with the patient. And in those cases, we need to give injectable, even acyclovir or systemic acyclovir.
Yeah, sometimes chickenpox, severe chickenpox can occur in a primary form in the elderly or adult one, and which is difficult to treat and even can be fatal. I think lung infection and other can occur. Good thing is now we have a chickenpox vaccine also available, conjugate vaccine, which can be given in 50+ of age, now available in India. So correct answer was D option. Thank you, Dr. Ramesh. And can we see that how many students were correctly able to make it out? Singles can also cause chickenpox. 33%. So it was slightly a tricky question. One third, one third, one third, and C option was given by none of them. So they still think incubation period because everyone think that once rash has occurred, chickenpox incubation period must be just after exposure within 2 to 3 days they develop this rash. But within 2 to 3 days you have to have a treatment as early as possible. But it's very contagious. It's from aerosols only infection, but very contagious. So as early as possible, if someone is immunocompromised, they should avoid the exposure and start treatment as early as possible. So answer D was the correct answer. Computer Ji, can we have the winner for question number? Winner for question number 15. So still we are 5 ahead from the end of quiz, and I think Shreyans is leading the score with maximum number of podium finishes. Just took 1 second to answer, Shreyans. Congratulations, and he's from New Delhi, Akas Healthcare Super Specialty Hospital. We can go ahead with question number 16, Computer Ji. 16, all of the following are physiological response to fever except, this is except question negative stem, decreased cortisol secretion, B is increased gluconeogenesis, C is negative nitrogen balance, D is decreased lipoprotein lipase activity in muscle and adipose tissue. Your time starts now. Thank you, Computer Ji. So this question suggests that because this is a fever quiz and a fever foundation quiz, so a lot of question will be regarding fever. Although this is not a common question in MD medicine that what is the physiological response, but you all should remember that what does happen during a fever. Like option A is given decreased cortisol secretion, which as such appears to be a wrong statement, because whenever fever or is a high grade fever is there, especially high grade, it's like a stressful condition. So there the cortisol secretion, which is a stress hormone, similarly catecholamines, which causes increase in the heart rate and increase heart activity, they will be increased in due with high fever, should not be decreased. So I feel A option was the correct answer, because it is the first option only and you have the one answer to be corrected. Followed by other options are increased gluconeogenesis. So you do need increase glucose for metabolism. When your temperature rises, your tissue decrease requires more of glucose. Similarly, negative nitrogen balance. So once fever lasts for some longer duration, your nitrogen balance will be reduced. Your muscle will have more catabolism, and decrease in lipoprotein lipase activity in muscle and adipose tissue is also not a correct statement. So I feel answer A is the correct answer. Computer Ji, can we have the correct answer? So it's a stress, fever is a stressful condition. So cortisol secretion will be increased in these high fever condition, and option A will be should be the correct answer. And let's see, Computer Ji, can we have the scoring sheet? Like I said, 83% have correctly answered it, and I feel the timing of answer should be less than, not less than, maybe 1 or 2 seconds only, because this was the A option. If it would have been a C or D option, they would have taken more time to answer the correct option. Computer Ji, we can have answer sheet also. Who is the correct winner? So Gaurav Chaudhary won this quiz. Which are the stressful hormones which help in fever? And he's from Mahatma Gandhi Medical College Hospital, Rajasthan. Very, very congratulations to Dr. Gaurav. We can go ahead with the question number 17. This is Gottron papules are seen in which condition? Is it SLE? Is it systemic sclerosis? Is it dermatomyositis? Is it mixed connective tissue disorder? Your time starts now. Thank you, Computer Ji. So 15 seconds without any wasting time. This suggests that Gottron papules, although this is more of a dermatologic finding, but disease is as such more of a medicine and difficult medicine like rheumatology. So Gottron papules are normally papules or a maculopapular lesion, mainly present in the knuckles or maybe a proximal interphalangeal joints. So these are the joints and these are the knuckles where there's a papular or a maculopapular lesions develop, and this is classically seen in patients with inflammatory muscle disease or a myositis, and they usually present first with a proximal muscle weakness. They have difficulty in climbing stairs, they have difficulty in walking, they have difficulty in standing from sitting position. This will be the initial features, followed by these papules may appear. Other than that, there may be a rash over the face as well as small sign over your back. These all other signs. So this is very classical for dermatomyositis, which is a type of a inflammatory muscle disease. I feel option C should be the correct answer. And SLE and all doesn't have Gauthran papule. And the systemic sclerosis more of have a Raynaud's phenomena, and they may have a digital scarring in the fingers tip, as well as they have a more of a thickening of the skin of the limbs, as well as sometimes in the face. So I feel answer C should be the correct answer. Computer G, can we have the correct answer? Okay, so dermatomyositis with proximal muscle weakness, and if they have a Gauthran papules, you have a clear-cut diagnosis. Previously, we used to do muscle biopsy and all, but nowadays we can even have some blood test to diagnose this disease, and very good response with corticosteroids. And mixed connective tissue disorder is another connective tissue disorder which may be similar to systemic sclerosis or SLE. Only thing is there's antibody test called UNRNP, and which is very strongly positive in these patients. Other than that, they may present as SLE or a systemic sclerosis. Computer G, can we have the graph to see dermatomyositis? C option was correctly answered by how many students? 80% of the students were correctly identified that dermatomyositis can present as a Gauthran papule. Very good to know. A lot of people are studying rheumatology also. And Computer G, can we have the winner for this Gauthran papule question? Computer G is taking some time to answer, and as well as leading the quiz, especially North Zone. Very high chances that Shreyans will be going to Bangalore to participate in the finals in PIFCon 2024. And I think more than 7 answers has already corrected by Shreyans. Congratulations. But still, there are 3 questions. We can have one more winner from here, at least out of those second and third place. Computer G, we will go ahead with question number 18. Question number 18, which is not a dermatomyositis specific antibody? These are the antibody tests. We have already answered dermatomyositis question. Is it anti-MDA5, anti-TIP1 gamma, anti-NXP2 antibodies, or anti-SM antibody? Your time starts now. The negative stem question, not. Okay, so time is over. 15 seconds is over. Slightly difficult question, but it's a postgraduate quiz, not for undergraduate quiz. And you have already 80% of the students have already read dermatomyositis. So I expect that this also will be answered by majority of students. So this was question is, which is not a dermatomyositis specific antibody, or also we call it myositis specific antibody. So all 3 of them are a myositis specific antibody, while one is not a dermatomyositis specific antibody. Let's see what is that antibody. Computer G, just let us know the correct answer. Anti-SM or anti-Smith antibody is not part of a dermatomyositis specific antibody. This is more commonly seen in SLE or a systemic lupus erythematosus, very specific for systemic lupus erythematosus, SLE. Other than that, we already know ANA and anti-dsDNA are also very specific for SLE, but this is more specific if someone is anti-Smith antibody, while all other 3 are myositis specific antibody, also called MSA. These antibodies are only seen in diseases in which you have an inflammatory muscle disease like dermatomyositis or a polymyositis. So anti-MDA5 antibodies in patient in which this is found, they have a very aggressive ILD, interstitial lung disease. They may have a sudden respiratory failure after the diagnosis, while comparatively anti-TIP1 alpha antibody as well as anti-NXP2 antibodies, they don't have a much of a ILD disease, but they may be associated with some cancer or a calcinosis. So if anti-TIP antibodies are present or anti-NXP2 antibodies is present in a patient of myositis, you should do CT scan, maybe a PET scan to rule out any malignancy. If malignancy is not there, you keep patient on follow-up to see that they may develop a malignancy maybe after 1 or 2 or 3 years. So they should be kept on a follow-up. And these antibodies have changed management of dermatomyositis. a lot of 50% of the patient may have these antibody positive. And if you find these antibody positive, you can start treatment according to the antibody profile. Previously, without biopsy, we were not treating this myositis patient, but now with these antibody availability, you can treat with steroids. If they doesn't respond, you can treat with a disease modifying drug like rituximab or any other disease modifying drug. So, Computer G, can we have the winner for question number 18? D option is the correct. And 60% of the students, like 80%, were able to diagnose Gautin papules and dermatomyositis. And next 60% were able to make it out that anti-Smith is for SLE, not dermatomyositis. So, Computer G, we can have the winner for question number 18. And everyone will receive certificate even if they don't reach the podium of first and second. So congratulations, Dr. Vidita. She is from Mahatma Gandhi College of Rajasthan. Just took 1 second to know that anti-Smith is for SLE, not for dermatomyositis. Computer G, we'll go to question number 19, penultimate question. So which of the following drug is considered as a narrow spectrum antibiotic? Your A is ceftriaxone, B is ciprofloxacin, C is aminoglycosides, and D is imipenem. Your time starts now. Thank you, Computer Ji. So this question was regarding antibiotic, which is very rampantly used without any rationale. So a lot of antibiotic stewardship program is done by government as well as each hospital. And in our hospital also, Dr. Ramesh and our medicine faculty are trying to make antibiotic policy applicable to our hospital, where we should use only antibiotic when there's a bacterial infection. And broad spectrum antibiotic is used rationally, not left and right randomly, because once these antibiotic get resistant, it will be difficult to treat these infections. So option A was given ceftriaxone, which is again a broad spectrum antibiotic, very commonly used in most of the infection. And Computer G will let us know, is it ciprofloxacin, aminoglycoside, or imipenem, which is more of a narrow spectrum antibiotic. So according to Computer G, they say कि aminoglycosides, especially amikacin, gentamicin, these are the antibiotic which is more of a narrow spectrum and should be used in patients who are more often gram-negative organisms, like they are very effective against Pseudomonas. So if you have a Pseudomonal infection or a gram-negative sepsis, you can use aminoglycoside. Otherwise, if you don't know the organism, so most commonly we use a more of a broad spectrum antibiotic. So ceftriaxone is a commonly used, while imipenem is the reserved drug, should not be used as a frontline drug. It's a carbapenem group of drug. Also, it's a beta-lactam. So should be only used when the first line drug are resistant, especially like this ceftriaxone or fluoroquinolone like ciprofloxacin and all. And only to be used patient who have already received antibiotic and patient who are not responding, or they have a culture sensitivity report which suggests that imipenem or a meropenem is sensitive, because treating carbapenem resistant is very, very difficult, like crab, which is carbapenem resistant, Acinetobacter baumannii and all. Then you have,
And Dr. Ghanshyam, that this antimicrobial resistance week prevention of this will be coinciding with our FEFCON. It will be from 18th to 24th November. So they are celebrating. Yeah,
okay. So it's not a day, it's a week, whole week.
it's a week. Yes.
Okay, okay. So that 1 week, if someone has a fever and especially should not take antibiotic, it's antibiotic free week we will have, and we will only take maybe a Dolo. Dolo 650 should act, especially that these fever, dengue and all should only take paracetamol only. There should be no higher NSAIDs. So Dolo will be good enough for these patients. Good to know that November will be a antibiotic stewardship program and antibiotic rational week.
Antimicrobial Resistance Awareness Week.
Persistent awareness is long week. Okay, 7 days. So, okay, we will participate with you, Dr. Ramesh. And now we can have the graph. Who is the correct percentage of correct answer? Very good to know that 67% of the students were able to make it, that it's a narrow spectrum aminoglycoside should be used in only gram-negative sepsis, and with maybe a Pseudomonas cover will be a very good option. Computer G, can we have the winner for question number 19? So Dr. Deepu is wearing the flag of New Delhi in North Zone quiz. Good, Dr. Deepu. We still have one more question to go, and this is the last question. This is last chance to be on the podium. You should be on first or a second position to reach Bangalore, to catch the flight to Bangalore of Fever Foundation annual event, November 2024. So best wishes to all of the winners, and best wishes to all the participants also for participating. And we'll go ahead with the last and final question, unless there's a tiebreaker. So this is a pictorial diagram you can see from BBC News. Identify the rest. Is it erythema infectiosum? Is it erythema nodosum? Is it erythema marginatum? Or is it erythema migrans? Your time starts now. Thank you, Computer Ji. So you can see the diagram here. Difficult to Google and all now. Time is over. And you can see there's a round lesion and there's a central lesion, red erythematous lesion. More of a macular. There's no papular lesion, not raised. So it's like a bullseye lesion. So it's the classically seen in out of these four options, one is correct. Only one is correct. And you should be able to know that which is a disease. Although this disease is very rare in Indian setting, but more common in US or a Western setting. But a lot of students are trying MLE, and they are going for US for their after post graduation. So they should be able to identify it, and they should also be able to treat this disease. So Computer Ji will let us know out of these erythema, which is this erythema bullseye lesion. We'll say this lesion. Computer Ji, can we have the correct answer? I think this answer is in erythema infectiosum. I think it's erythema migrans. I think it's not erythema infectiosum.
Yes, sir. This is slightly
Different. I think
yes,
the
yes.
company said
No, if you all agree, I
We
think then
can
we
disqualify this. Yes, sir.
disqualify and we'll take another one.
Let's
We'll
see.
not go
We can
further.
see the
Have answered.
scoreboard, I think, sir.
Yeah.
Can we see the answer to the students?
Yes, scoreboards.
Let's see the percentage of answer.
Yeah, let us not see the name, but only the graph we can see.
Graph we can see.
Graph we can
Don't
see.
show the name. Don't show the name.
And
Okay, very US and erythema migrans. So it's a bullseye lesion, especially seen in Lyme disease. So our jury is of the
We'll
opinion
remove
that
it.
this question
See, when
should be
there is some
removed.
ambiguity,
So
experts
is
are not
there.
agreeing, we remove that and we'll take another question. We disqualify it because of ambiguity, not acceptable to the experts present here. Over. Thank you.
So
We'll
we
have one
will
more
have
very clear one.
one
Yeah.
more question, different
Yeah,
question that may take some time by our Computer G.
No, sir, it is ready. They can take it.
Is ready now. So we will go ahead with question number 20 again. And okay, so this is question number 20, not question number 1. Following a recent outbreak of floods, steps to be taken to prevent leptospira infection. Which of the following is false? It's a false statement. Mapping of water bodies must be done to establish a proper drainage system. Is it chemoprophylaxis with doxycycline is required? Rubber shoes and gloves should be used, and anti-larval measures must be taken. Which of them is a false statement? Your time starts now.
The easy one, actually.
So this is again, I think it's a public health question.
Yeah.
So nowadays, monsoon is going on. A lot of leptospira infection is happening. This usually happens due to contamination of the water bodies and water from these excreta of the rats and these mainly rats only. So Dr. Sudarshan will like
D,
that.
D.
So sir say think that antilarval should be taken is the wrong answer because there is no larva there. And
Yeah.
this is a microorganism which infect the water. And if it is if you get exposed to these infective water by maybe a mucous membrane, or if there is a cut and or a wound, then you get infected. So you don't need any anti-larval measures, especially for vectors and all. So Computer G, can we have the correct answer this time? Okay, so D option here again was the correct answer. So we have gone through 20 question overall, and with this we will complete the initial phase of North Zone
No,
quiz.
graph and name.
And we will have a graph first,
name.
and Dr. Sudarshan helped me in this question. So 60% of the students correctly answered about this preventive measures. Anti-larval is not required in this disease. And we can have the winner for question number 20, Computer G. Dr. Sarthak. He's from Rajasthan and he was on podium, I think, previously also. So very good to know that within 1 second he was able to pick that anti-larval measure is not required for leptospira. This is another disease which is a treatable one. And I will just like to tell the students that if there's a tie break in position 2 and 3, or maybe more than 2 winners are there in initial position, we will have a 3-question tie break. And I will like other experts and our jury to give us some comments and opinions, so that till Computer G take his time to.
I think I am admiring Professor Ghanshyam Pangte for the marathon way in which he conducted his
Yes, sir. Thank you. So,
20 questions marathon, rapid fire. Thank you. It was really very fast, and but for that we would not have come to this stage by 9 p.m. Thank you very much. And for me also it has been marathon.
Dr. Ramesh, Dr. Subbalakshmi, everyone helped us, and Dr. Anupam is there to guide us. So I hope we are able to do 4 days marathon quiz.
Yeah, sir. Anupam sir, by the time graph and all comes,
Well, thank you to Dr. Ghanshyam and Dr. Ramesh and Dr. Shubhlakshmi, who have carried today's program also very nicely. And Dr. Ghanshyam is the marathon horse only, Lambi Race Ka Ghoda. So he will continue like this, and year on year, there is no doubt about it. And not only Ghanshyam, but Ramesh as well as Dr. Shubhlakshmi is also like that. Dr. Sudarshan sir, they will become white-haired like you and will be still sitting here for next 25 years.
Correct.
The moment they get white hair, I will leave the podium.
You will continue to make a century and be here as a jury. They will continue as senior members doing quizzes.
Thank you. Thank you.
Sir, I think before white hair, we will have loss of hair.
For me, it has been marathon because every day
Sir
I have
has
attended
4 pediatric, 4 medicine.
Pediatrics also I am jury.
Yeah, sir has
For Dr. Sudarshan, Dr. Manjula, you should keep alternate. You should have 2 juries and keep alternate.
But we won't
Actually,
get
Dr.
person
Sudarshan
like
is suffering
sir, no.
because of Dr. Muruganathan's absence. Dr. Muruganathan is not there.
Yeah. So it's okay. I was relatively free, so I have made myself because I learn. It's also an update for me. See,
And we learn from you also. So for students, it is very important to understand that yes, the medicine and medical sciences, it is a continuous learning process. And just like Dr. Sudarshan is saying, for us, my hair are not so many white, but I am much older than what it appears on the camera. So we should keep on learning even at this age, and continue to learn till we reach Dr. Sudarshan sir's age. He is one of the senior most persons out here, and he is really a very senior stalwart and a national figure of eminence with international recognition also. He has many awards to his credit, and it is a privilege to have him here for the jury. And it speaks of his patience as well as perseverance that he has been there on all 4 days, 4 p.m., 7 p.m., 2 hours each. Today, if we ask any of the audience to sit for continuously in a day in the conference, we are not able to do that. So that was the scene when we were also students. It is very difficult because you have so much of energy. You want to keep on moving around and interact with your fellow colleagues. But to learn and to imbibe from whatever the speaker is saying, it is important to be attentive. And that attention span, that patience is very important. So one of the coaches that he has just resigned, that has just completed tenure, Dravid, you have to have Dravid, Tendulkar, all those things creators. They had a lot of focus and patience, and they had that focus that they could stay there at the crease, concentrate upon the bowling, etc. So that is very important in our profession also. And split second decision making is also very important that you come to harbor with this quiz. So, well, I think the result is ready, and Dr. Ghansham and Dr. Manjula, please.
Ghansham sir,
Yeah.
you can announce the results.
Yeah.
Okay, I think Computer G will let us know if there's a tie
Yeah.
break or not, and who is the winner.
Yeah,
Okay,
no
we have a
tie, no
clear-cut
tie, no.
winner. Thanks, congratulations, Dr. Shreyans Goel. We should write medical college also with this from where, but we know Deepu Rajan is there again, sir. So
Yeah.
congratulations, Dr. Deepu. He has secured second position, and here first and second are equal because both will be part of the final quiz in Bangalore in November. So we have a two winners, winner and first runner-up. Shreyans Goel is the winner. I think he's
I
from
think this is
Rajasthan.
the highest. This is the highest on all the 4 days, 6 and 5. The first day was also probably 5, something like that. But toppers, first and second, getting 6 and 5 out is really creditable
Good. Good.
out of
Right, sir.
20.
Right, sir.
So I think we can conclude. Yeah. Name is this one, college and city is
Yeah,
there.
sir, Dr. Ghansham sir, you will announce.
Yes, so winner of the North Zone is Shreyans Goel. He's from Akash Healthcare Super Specialty Hospital, New Delhi. Okay, so he's from Delhi. Congratulations. And second one is again from Delhi, and he is from ESIC Model Hospital. It's a Basai Darapur Hospital of ESIC. And congratulations. So both are from New Delhi. Good. So we have two participants from Delhi. Whole of the North Zone they have won. And I think Deepu Rajan will be the second time participating in this North Zone quiz. And congratulations to both of them. And I will request the Micro Team and Fever Foundation to let them know how they will get the certificates and where they have to collect the air tickets and the prize money.
I thank you very much, sir. Thank you for all the quiz masters and quiz host and jury member, Dr. Anupam Prakash sir, Dr. Ghansham sir, and Dr. Ramesh Agarwal sir, and Trubhalakshmi madam for helped us in conducting this for so many years. Continuously, they are helping us for past 7 years for conducting this quiz. Without them, we wouldn't have conducted this quiz at all. Thank you, each one of you, for helping us in this scientific activity. Thank you so much. And a heartfelt thank you, Dr. Sudarshan sir. He is also there with us for every time as a jury. Every year he's there as a jury, patiently sitting and finding out what faults are making and giving the fair results. Thank you so much, sir. And I congratulate the winners, Dr. Shreyank Goel and Dr. Deepu Rajan. So you will be contacted by our Fever Foundation team. They will give you the details. And I also congratulate all the participants. I would like to announce that all of you will be getting the participation certificate. And the next competition through Fever Foundation for postgraduates are poster presentation competition, where the last date is September 10th to submit your poster. The poster has to be related to fever, or it can be interesting case study related to fever. All the details will be sent to you, and also it will be notified in your respective colleges. So thank you so much, and I hand it over to Mr. Praveen Singh to give the final vote of thanks before we close this session. Over to you, Mr. Praveen.
Thank you, ma'am. Thank you. And first of all, congratulations to all the participants
And congratulations to the winners of North Zone Quiz on Internal Medicine. And I'm sure we'll be meeting each other in Bangalore. And if there is any change in program, PepCon, if at all, if it is to be conducted uh, through only Zoom and physical is not possible, then we'll keep you posted on that. And thank you all the, particularly Dr. Anupam Prakash, for being there all the time and then guiding us. Dr. Ghansham Pante Saab, busy schedule. In spite of that, being there on all the days and then making the quiz more lively and quite encouraging was the presence of our Dr. Sudarshan sir, who has been, kind of, taking us in the right way, and any loopholes, he immediately identifies and making this a very, very highly professional and probably we can match. It's one of the best in the, kind of the quizzes what is going on all around the globe. And I thank our medical team headed by Dr. Manjula. And thank you very much, ma'am, for being
My
there all
pleasure.
through 21. I mean, I have just seen like 13, 14 hours you have been with us all through for the last 4 days, every day 13, 14 hours. And RX Events team, thank you for seamless streaming and, taking up all our last minute, changes and other things that whatever we have been wanting to do, you have executed very well. And last but not the least, Mr. Atharva and Miss Deepika, for kind of coordinating between RX Events, medical, and myself and all the other concerned. Wonderful job. And so we come to end of the third year of Fever Quiz is completed. And the finale, the zonal quiz is completed. The finale is going to be, we will communicate to all the the winners in consultation with the advisory board members of your foundation, the date and all. Thank you very much. Looking forward to meet you all and then communicate with all the participants during the poster presentation competition. Okay, thank you and good night.
Thank you
Thank you
and
all.
good night.
Namaste.
Thank you.
Good
Good
night,
night.
sir.
All the best to
Thank you.
everybody,
Thank
and
you.
thanks.
Thank you.
Thank you so much,
Congratulations
sir.
to all the
Thank you.
participants and winners.